My name is Akanksha Sharma. I am a neuro-oncologist and a palliative care specialist, as well as a neurologist, and I work at Pacific Neuroscience Institute. And this is a PNI Minute. Radiation therapy after surgery can take place for a number of reasons. One, there might be tumor that is residual or leftover after surgery and we need to treat it. Number two, the surgeon may not have been able to get all of the tumor from the brain because it's in an unsafe location or where surgery would have caused harm. Or number three, sometimes there are types of tumors that are infiltrative or they're mixed with healthy tissue, and the only way to really treat all the residual disease is to do additional radiation. So patients may get radiation therapy depending on the type of tumor they have, and depending on the location of the tumor, it might be a few days or several weeks. Chemotherapy, or depending on your case, immunotherapy or targeted therapy, is usually an IV or oral medication that you take that is a longer duration of treatment, and it's working differently. It's still affecting the tumor cells and affecting sometimes the DNA of the cells or preventing the cells from dividing, but it will be usually something you take for several months or up to a year, or sometimes a couple years, to slow down the growth of the tumor and prevent new growth. One question I frequently get as a neuro-oncologist is, what kind of diet should I be on during radiation therapy? Is there something that will help me feel better or get through radiation better or help my treatment? And at this point, the studies that have not shown any significant benefit for any one diet over another. We do recommend that all our patients consider whole foods or a Mediterranean type diet, because we know in general that those kinds of diets are healthy. So we really encourage our patients to let us know if they're taking any kind of new supplements, if they're trying any new diets, and then we can work with you together to decide what is acceptable and what might be actually harming your treatment or work against your treatment. Another question I get is the ketogenic diet something I should do? And this is something that we're still learning a lot about. There are a number of great trials going on, and so we should hopefully have an answer in the next few years. For now, we find that the ketogenic diet may be helpful for some cancers. It's not necessarily the holy grail for everything. So usually in our practice, we talk to our patients if they're interested in the ketogenic diet, try to direct them to certain resources, and we make sure that they're always balancing their quality of life with what interventions they're trying.